Probiotics 10 years ago were a small category of nutraceuticals. Today, probiotics is on the verge of global acceptance by the medical community. Why is that? Dr. Nigel Plummer, an expert in probiotic research and development, and who has published over 100 papers on the topic, is passionate about probiotic research. Due to his research and development, the Genestor HMF antibiotic care has been developed. So why this explosion in probiotics? Dr. Plummer, can you help shed some light on this?
Well, I think that we really are on the cusp now globally of acceptance of the use of probiotics alongside certain areas. One of these areas is gastrointestinal effects, so particularly along the use of antibiotics, and in gastrointestinal conditions such as irritable bowel syndrome. Similarly, what we're seeing is that there's a huge amount of research now looking at the effects and showing benefits in use of probiotics in the neonatal period. If we add to that we're seeing benefits generally with probiotics in the immune system in terms of children and adults, in decreasing, let's say, coughs and colds throughout wintertime, then we can see that there's this burgeoning impact of research globally is bringing probiotics to the attention of the medical sector and bringing probiotics to the point where the medical sector is beginning to say, okay, this is something we can use because we don't have anything else that we can use for these areas. We don't have anything else that can, if you like, help the microbiome following antibiotic research.
Okay, so if we can just go back then, can you elaborate on this use after antibiotics or with antibiotics?
Yes, and if we look at the effects that antibiotics have, antibiotics are a fantastic category of drugs, but they do have side effects and they will have a negative impact on our microbiome. And we're beginning to understand how important our microbiome is. And what we also know is that the way that antibiotics work, they will have a devastating effect on the intestinal flora in the upper intestinal tract, so the duodenum, jejunum, and the ileum, where you've got a small and fragile microbiome present. So what we understand then is that probiotics can have an impact in preventing overgrowth of undesirable flora during the course of antibiotics.
Be crucial for health. Can you help us understand then how would you take a probiotic during antibiotic use?
Well, we actually did a trial several years ago where we looked at whether you should be giving probiotics after the course of antibiotics or actually during the course of antibiotics, which sounds as if it's you shouldn't really do that because the antibiotic is going to have a negative impact on the probiotic. But what we actually found in this trial was that we saw greater benefits when we took the probiotic with the antibiotic rather than when the probiotic followed the course of antibiotics. But let's be clear, when we're saying that we're giving the probiotic with the antibiotic, it's during the course of the antibiotic, but you don't take the two pills, if you like, at the same time. You need to take the probiotic away from the antibiotic, so it's not in the stomach with the antibiotic at the same time. So that's basically 2 to 3 hours away from the antibiotic use.
Right, that sounds very important to know. And what about the safety of them? Is it safe to use probiotics and antibiotics together? What is the safety of probiotics?
And the safety is absolutely clear. The type of probiotics that we use now have an unblemished safety record in use in newborn babies and in adults. So the one thing about probiotics alongside antibiotics is that you will only see benefits. The absolute worst outcome is that you see no effect at all.
Right. So what about curing? You could just eat food. If you've had an antibiotic, you can restore the probiotic by just eating food.
Well, food, if you look at probiotic foods such as yogurt and sauerkraut, they do contain the types of bacteria that we see in probiotics, but they don't have typically the ability to colonize the intestinal tract that specific probiotic supplements like the HMF range have.
So something like the HMF, antibiotic care, how is this different from other probiotics on the market?
Well, this is one that we've used in our clinical trials, and in a sense, the only reason that this, I suppose, should be used or can be used is that we've demonstrated specific benefits of this. So we have demonstrated reduction in antibiotic-associated diarrhea with this product, and that's meant that in Canada we can have the claim HMF antibiotic care. So this one, I suppose, as opposed to the other probiotics that are on the marketplace, has been shown to be effective.
So clinically researched to be effective. Can you comment on dosing, therapeutic dosing? What does that mean, and what is a therapeutic dose?
Okay, how we normally look at this now is that if we're using, let's say, a low-grade or incidental antibiotic treatment, ampicillin, for instance, for maybe 7 days, then we can use either HMF antibiotic care or HMF intensive. If we're using a more powerful antibiotic or it's for a longer period, then we need to use HMF antibiotic care because this has a higher dosage.
So in summary, the important thing is to find a clinically researched with a therapeutic dose for the right condition that you're looking to deal with your health.
Yes, yes, and that's true across the whole range of probiotic applications for whatever use. And with this product here, we've also done an additional trial whereby we showed that the level of resistance to antibiotics in the regrowth flora following the use of the antibiotic is decreased by the use of this product. And that could be a potentially huge, globally changing outcome.
More research coming.
More research coming.
When looking for a quality, professional, clinically researched probiotic with therapeutic dosing, look for the HMF antibiotic care. Ask your healthcare provider, your pharmacist, or visit your specialized health food store, or visit soroyal.com for more information.